Okay, so today we're talking about another part for children's illness, intestinal parasites or worm. So that's pretty commonly happens in the children and cause children a lot of other problems or issues like poor digestion we talked about before. So intestine parasites or worms. So that's basically is the illness caused by some parasites. These parasites especially go to human beings and they can live in mainly in small intestine. Truly, some parasites they possibly travel to other parts of the body. So we have lot of different type of the parasites. We just pick up three, commonly one, and put in here. So that's we discuss different parasites. They have their lifestyle and life cycle, and they may cause different troubles. Now we go to the different parasites one by one. Yeah, we go to some commonly parasites one by one. The first one we go to roundworms. So roundworms, it look like this. Yeah. So they are pretty long. They are pretty long, and sometimes they have some curves there. So that's roundworms. So roundworms is the parasite living in the intestine. So their transmission way, like people touching some infected kind of stool, humans or maybe animals, then prepare food, then eating food, then they got parasites go to intestine. And also sometimes like touching some infected kind of surface and then eating or drinking. So still through the digestion systems and go to inside the body. So that's the get infection way. So basically roundworms, it coming to inside the body is the eggs. Yeah, it's the eggs. It's not like we see the picture. It's truly that kind of parasite directly go to our mouth. I believe everybody see it will not eat it. But the eggs is pretty smaller. You couldn't see it. So that's why people got contaminated from the food, from the drink, from the hand, and then go to inside the body. When the eggs, yeah, parasites run wild, the eggs go to inside the body. Then they development to adult roundworm. So they are in the intestine, small intestine. So what kind of problems if have people got infection of the roundworm. So basically, they are injured intestine and sometimes stomach. So that's truly got some qi go to wrong directions, so disturbing intestine qi. That's caused abdominal painful situation. So that's mainly people got roundworm infections. They postpone have abdominal painful and sometimes even cause nausea. Nausea is stomach qi reverse. So roundworms in there and cause stomach qi reverse. And certainly they go to their cause blockage in there. Anything blockage in there can generate heat and also can generate some dampness, especially in children. We say children's organs functions generally say it's kind of weakness in there. Plus they got infections of parasites caused more weaker. So they couldn't circulation everything properly. So generate some heat and possible generate some damage. And cause the children irritability. And restless kind of sleep. So like always moving when sleep. And also possible cause the rashes on the body. And truly, they also can directly blocking the intestine and also can cause some scar in there, damage small intestine and cause scar. Severe case, severe case. We say they may cause the ulcers and then scar tissue. Severe case, they even can make a hole in the intestine. So that's basically if this kind of situation happens, it's a pretty severe kind of disorder. So that's kind of from small intestine can go to abdominal cavity. So cause the inflammation in it. And also sometimes they can go to the gallbladder tube. So that's we talking about, that's the liver. That's the gallbladder right under the liver. And the tube opens to small intestine. Yeah, they connect it with the pancreas tube together and then go to small intestine. So parasites in the small intestine. Here is the first part of the small intestine. So all small intestine have 3 parts. But open part, gallbladder tube, open to first part of small intestine. So truly, roundworm can come in from the open here and then go upward and cause the blocking there, cause painful situation here. So that's another emergency kind of situation. Patient suddenly very severe kind of abdominal pain, especially on the upper right side quadrant there. That's right and like liver and gallbladder location. And sometimes when we talk about Western medicine diagnosis, morphic sounds positive. What means morphic sound? Put your finger here and tell the patient deep breathing. And then patient suddenly stop breathing because pain. So that truly something happens in the gallbladder movement. So that's basically like the roundworm caused the body changing. And later on, long-term health parasites will cause the patient poor nutrition because the roundworm they're eating nutrition. So everything children eat just fitting for the roundworms. So long-term cause the poor nutrition. So that's about the roundworm. So symptoms here, symptoms here. Sometimes they may know symptoms. Small amount, not that severe situation. And if truly have a lot of parasites inside and also cause the infections, truly can cause painful situation. So abdominal pain, sometimes stomach pain, come and go. And also possible can cause the blood in stool with a parasite truly damage small intestine, cause some ulcers there, and cause some bleeding inside. And the bleeding can pass from the stool. And maybe cause diarrhea. So that's disturbing internal environments like small intestine functions and even large intestine functions. So cause people diarrhea. And also we say they blocking the qi circulation there. Also can cause some dampness of heat. Maybe damp heat combination kind of diarrhea. And the long term later cause people poor nutrition and weight loss. So that's the general symptoms of the illness. So our treatment principle, mainly when they got pain, we stop pain. But we try to relieve the roundworms. And the roundworms cause the children spleen stomach kind of difference in there. So we regulate spleen and stomach. So truly parasites, maybe we are not use acupuncture. Only use acupuncture, maybe not that working well. So use some drugs, including Western medicine drugs, or maybe Chinese herbs, together with acupuncture. So acupuncture points we treat roundworms, stomach 25, regular large intestine, and 人跳 regular middle jiao. Then we need some qi tonified, spleen qi tonified. And stop pain, pericardium should be 6, I'm missing 6 here. Stomach 6, stop pain. And also, like the parasites especially go to the gallbladder and generate some damn heat in the gallbladder. We can use gallbladder 34 or maybe with 胆囊穴 Acupuncture. So Acupuncture 胆囊穴 is under gallbladder 34, about 1 to 2 cm. If patient have gallbladder disorder, you palpation for that part, find the tender place, then needle there, or maybe acupuncture there for children. So that's generally. So we need to kill parasites. Then we regular the middle gel and the tonified spin qi. And if patient have poor nutrition and getting recovered. Now we move into the pinworm. Yeah, pinworm. So that's the adult pinworms look like. That's the eggs of the pinworms look like. So pinworms still belong to parasites, still in the intestine. So pinworm, it happens nothing relationship with seasonally and pretty popular in the world. And commonly in the children. And the lifetime is short. Yeah, we will talk about pinworm some detail later. So it happens like a pretty rapidly, and then children have some symptoms. And their pinworm lifetime is shorter. So generally speaking, they only like in the body 2 to 4 weeks. And then they production some eggs. The adults will be died. So basically, if we can preventing it like repeatedly got infections, truly these kind of parasites can treat it like just by itself or maybe without treatment. So that's the pinworm. So let's see the pinworm. So basically, I will say, pinworm infection, the people, mainly in the large intestine, a little bit different with roundworm. Roundworm mainly go to small intestine. Pinworm mainly go to large intestine. And after mating, the female worm died quickly. So they immediately die. And then the female pinworm even moving more downward in the intestine, like the ending part of large intestine. And at night, they move into rectum. So basically during that time, people sleep. And then the pinworm, female pinworm we talked about, coming out of the anus and then producing the eggs outside the anus. So the eggs take about 6 hours. They will mature. Then they can infect other people. So when they producing the eggs on the ants, that will cause the people very itchy around the ants area, especially for the children. When it itchy, they will scratching the skin around the ants. Then the fingers will be contaminated. And like children, sometimes they eating something, they don't wash their hand, or even sometimes they put their hand to the mouth. So that way got a reinfection. So like goes back to digestion system again and go to reinfection again. So that's the mainly way got infections. Certainly, sometimes the eggs falling down to the dusk area, some objects area, and then touching it or eating it. Sometimes even inhale with the air, got contaminated kind of air. Still possible got infection, but that way not that common. Generally say it's contaminated hand or contaminated food or even contaminated water. Then go to digestive system again. Then follow the circle again. So that's pretty easily spreading in the family. And also for children, go to kindergarten. If one children got problems, the other children pretty easily got problems. So that's generally the life cycle of the pinworm. So just like this picture here, just like this picture here. So contaminated food go to inside the mouth and then go down, go to small intestine and later on go to large intestine. And from there, they mating, female and male mating. And then the male died, the female producing the eggs outside of the arms, and then female died also. So if we cut from here, like just a few weeks, intestine pinworm will all die. So that's not cause the severe trouble. But the trouble for the pinworms, mainly reinfection, is so easily caused reinfection because they producing the eggs out of the arms and cause the itchy, and the children pretty easily scratching them, and then touching the face, touching the tool, touching everything or eating, then reinfection. So that's basically. So symptoms still depending how severe infection in there. So some people still may don't have symptoms. But if kind of severe infection in there, the common symptoms still abdominal pain, still diarrhea, still sometimes cause nausea, vomiting. So we couldn't find the symptoms truly like separate what kind of parasites in the intestine, and still cause body weight loss, poor nutrition. if we try to say something special for this kind of pinworm, thus usually they cause the itchiness around the arms or genital area during the sleep, or maybe some rashes in there because they producing aches during people's sleep time. So that's something special for the symptoms. Others pretty similar, like other parasites. So treatment principle, we still try to kill the pinworms and relieve some itchiness. That's basically around the around the arm's area. And more important, pointing. Yeah, pointing repeatedly infection. That's more important in these parasites. Like we say, if not repeatedly infections, the parasites will die during few weeks. So I didn't put the points here. So basically acupuncture points, you can use exactly the same with the roundworms. But still, if you have parasites, still better use drugs or maybe with the herbs together. Acupuncture itself may be not that stronger like a killed parasite. So that's the pinworms. Then we go to another parasite, hookworm. So hookworm, they named, they just like a hook there. Yeah, like a hook there. So that's the shape of a hookworm. So hookworm still parasites in the small intestine. Hookworm cause problems. Still have kind of abdominal painful situation, and the patient may be constipation, maybe diarrhea. And the hookworm kind of patients, they may have a special kind of habit. They eating everything. Some children they eating the soil like the earth. Some people eating the metal. They couldn't totally eat it, but they just put it in the mouth. And the different people, like the eating habit is different, but they are pretty like eating some strange things. So that's possible some hookworms. And other problems, they may cause the bleeding in the digestive system. Long-term bleeding cause people anemia. And certainly poor nutrition, people weight loss. So that's basically for hookworm. So hookworm, we say they still in the small intestine. And still female, the parasites can producing the eggs. And the eggs follow our stool, go outside of our body. So these eggs producing in the small intestine. but still follow the stool, go outside. And then the eggs coming outside of the body, basically some suitable temperature air, more like warming, moistening air, like the soil, with enough oxygen. And then they gradually, like changing kind of maturity. So basically, they can live on the soil for about 15 weeks. So that means if some people got infections for the heartworm, then they have bowel movement. They go to somewhere and contaminate some food or some earth or whatever, or superficial of the environment. During 15 weeks, still possible some eggs living there. Then other people like contaminate, and then like they got reinfection again. So basically, they go to inside the body through the skin. So these parasites infect the people mainly directly invading through the skin. And then from the skin go to blood vessels, or maybe go to lymph vessels. And from blood circulation, we know all the blood circulation finally go to the heart. And the lymph circulation, they still go to the vein. They still follow the blood, go to the heart. From the heart, go to the lung. So we have a bunky tree in there. So that they can like go to our respiration system. So if the that's the younger parasites, like living in the lung, they even can like follow the people cough, follow the phlegm. We can find it. That's the younger one. And the other part, we know our respiration system show the same passing route in the salt area. So when they coming out, some coming out with the phlegm. Another part may be by people swollen down and then go to small intestine. And then from small intestine, development to the adult parasite. So then go to the circle, producing the eggs in the small intestine again. So these parasites truly have pretty longer living time in the human body. They generally can like living in the human body about 7 to 15 years. So that's even more difficult to treat the parasite. So we're still talking about the treatment principle here. So people got the parasites. Generally we say they must have some deficiency. We're talking about 正气壮 passenger will not able to evading. So parasites still belong to some passenger. Yeah, it's not truly, usually we're talking about external passenger, but still belong to passenger, cause illness. And also, these parasites usually cause the bleeding. So that cause more severe qi and blood deficiency. So we try to kill the parasites first, then tonify qi, tonify blood. So build up our spleen functions. That's our nutrition coming from. And then get enough nutrition, build up qi, build up blood. So generally say the points here still pretty similar like before we talked about. So regular intestine, stomach 25, and the regular middle jiao, ren 12, and the stomach 36, qi blood 25, and the spleen 6, still spleen 25. We still can go to some like breakthrough points, like spleen shu blood 20. Even we can go to kidney shu, blood 23. So generally say, small case have some trouble or got some problems. It must be have some degree of kidney deficiency, kidney access deficiency. So their organ not totally development, then they will be weaker. And still use with the drugs or herbs together. Yeah, not only use acupuncture. It's not that working well. Yeah, it's not that working well. With drugs and herbs together. Preventing. So still more important part for parasites, preventing. So we know which the way cause the like a parasite infection. So we specially preventing in that way. So for hookworms, if patient have the hookworm illness, need pretty be careful, like their face, and the treatment, treatment for the patient. And certainly other people need to be careful, hydrogen, stronger the bodies and not contaminate with infected kind of soil and not like eating some raw food or even not like drinking raw like raw water kind of vegetable. I think in China, like before, more children pretty easily got parasite infections. So for most Chinese, they will have like to drinking boiled water. So truly boiling water will kill the parasites, like parasites eggs or other pathogens like bacteria or virus. So that's mainly for most Chinese, they like to drink boiling water. Even boiling it first and then waiting it cooler to drink, but still boiling water. So that's one of the reasons preventing infections. not only for the parasite, also for other infections, including bacteria and viruses. And certainly, hand hygiene, washing hands before eating, after bowel movement. So that's basically. And these parasites, especially like through the skin, go to inside the body. So if you go to especially like parasites, hookworm, popular area, don't walk in with barefoot. That maybe got infections. But generally, I think in here should be okay. We don't hear like people have so many kind of these kind of infections. And stronger the body, yes, stronger the body is build up 正气, get more nutrition, get immunity functions is strong. So that's preventing for not only for the hookworm, also for other